Hello everyone and welcome to our channel. I am Dr. Manuj Wadhwa, Chairman Elite Orthopaedics, and today we are going to discuss on a topic that is going to revolutionize our science of orthopedics. For many decades, chronic knee pain has been taken as a march towards operation theatre. But you know that today there is a paradigm shift on joint preservation. I'll call it as preserve the knee, save the knee, and that is called as a science of self-healing. The topic we are going to discuss today is orthobiologics. So friends, what is biologics? Biologics is a science of self-healing where we use our body's own self-defense system. And when this is applied to orthopedics, it's called as orthobiologics. So I would say biologics as a simple conventional way. जैसे हम कहते हैं ना, तुम्ही ने दर्द दिया है, तुम ही दवा देना. So our body created a disease, created the wear and tear, and the body's own defense system will be utilized now for the healing process, which will help decrease the pain, which will help decrease inflammation, which will enhance the recovery, and for many cases, delay the need of surgery in their lifetime. So let me take you to this world of orthobiologics. So what is there in orthobiologics? So we are going to talk of two things. The first is called as PRP, which means platelet-rich plasma. So your own blood is taken out. It is put in a machine which does the centrifugation. And from there, the platelets, which are very rich in growth factors, are taken out, put it in a syringe and injected in the painful area, whether that is the elbow, that is the heel, or into your knee joint. And they have a high potential of self-healing, self-regenerating tissues, which are going to formulate its own level of repair. The second thing in orthobiologics is called as BMAC, Bone Marrow Aspirate Concentrate. That means from your iliac crest or the hip bone, the tissues are taken out. They are concentrated. The stem cells, which are very rich in growth factors, are concentrated and then they are injected into the painful area. Now, with the stem cells, there is a latest approval from DCGI, that means from the government, and we have got is called as mesenchymal stem cells, which are allogenic. That means stem cells taken out from healthy donors, harvested in the companies, and come back to us for injection into a minus degrees or a frozen chain that is there. So these stem cells are derived from healthy donors. So they are very rich in growth factors. When they are injected into the knee joint, they help into the natural ways of repair and regeneration. So when we talk of orthobiologics or the science of self-healing, we will discuss about these substances and how they help in repair or regeneration of your own tissues. They are used in conditions like osteoarthritis, like tendinopathies, like any ligament surgeries. So they help in repair, they help in regeneration, they help in fastening your recovery, and they help in decreasing the pain that is there or the inflammation that is there. While I'm discussing that there is a paradigm shift today from replacement to preservation of your natural joint, it is very important to understand that this has a role in early stages of the disease when the disease is in early stages. But at the same time, if you have an advanced disease where the joint is already damaged, where the quality of life is totally hampered, in those cases, still the gold standard of joint replacement will be playing its role. But today, we want to control the disease in a very early or a beginning stage, so that fundamentally we control the disease in the beginning and we can delay the progression of the disease. So for all those patients coming to us in early arthritis, in their ligament injuries, in the tendon irritation, in the ligament irritation, we are using a lot of these PRPs, these stem cells in different indications like avascular necrosis, which means loss of blood supply into the hip joint. So this paradigm shift is making us believe stop the disease before it progresses. So The role of these orthobiologics is not only in prevention but also complement when we speak of joint replacement surgeries. How they complement? They help enhance the healing. So when these injections are injected around those points, the healing response or the repair response is enhanced and your patient gets back to activity very fast. Reduce post-operative pain and inflammation. As we discussed that these growth factors have anti-inflammatory properties, so when they are injected inside the joint, they will decrease the inflammation at a much faster pace, which helps you recover very fast from any surgical intervention. So today, the world is moving on from the surgical side to the preventive side. And the preventive side, the first message which is there very essential to remember across is that we need to use these technologies in early stages. So it's very important. Do not overstretch your pain. Do not delay and reach to a stage where the cartilage is totally worn out and we cannot offer you these preventive choices. So friends, the field of orthopedics is really promising and the research is going on a very fast pace. So remember, these are not magic bullets, but these are definitely transitional tool, a fundamental tool which is taking the shift from the surgical to the non-surgical side. And there is a growing interest of this in the Western world, and now in India also people are getting aware. They're coming back to us. Why not, doctor? Help me save and preserve my natural knee. So friends, if any one of you has an issue with a joint pain, please go back to your specialist and discuss whether you have these orthobiologics as one of the option to naturally preserve your joint, to protect your joint, or in any cases where you have a tendon or ligament injuries, is there a space for these kind of injections to be injected which can help you salvage or prevent a surgery and preserve your joints? So we are committed to empowering your journey towards a better joint health. Thank you for watching. If you think it helped you understand the role of orthobiologics in orthopedics today, please like the video, share it with somebody who must be struggling as to find out non-surgical options. And for better information on joint health, please subscribe to our channel.